Wisdom teeth, Dr. Vuong. Number one, I mean, the most important question about wisdom teeth is, do they really make us wise? I mean, because I'm worried about this. I never had them, I think. I don't remember any dentist ever talking to me about wisdom teeth, and I don't remember having had any of those tragic surgeries which everybody's talking about. So, kind of let us know about why is this wisdom tooth operation apparently such a big thing?
Well, first of all, wisdom teeth, almost everybody has wisdom teeth. It's actually very rare for someone not to have any. Of course,
maybe I did. There was no drama behind it, so I just don't know.
Yeah, I would say majority, 99% of us have wisdom teeth, whether it's, all four, or some just have three, some have two. Very, very few people have none, but I'm sure there are. But it's really important for patients to have their wisdom teeth evaluated by a dentist to see if they need to be removed. And I would say 90-95% of all of us don't have the room necessary to keep our wisdom teeth.
Interesting. So something is growing in our body where it's not made for it. So we were as a species, we were kind of changing and shrinking, and and just not needing a particular part anymore, but yet it's still growing and it doesn't know where to go.
Yeah. Well, the theory is that wisdom teeth were really important during the caveman days because our diet was different. They ate things that are a lot more abrasive than what we eat today. All our food's much more refined. And during those times when the food was much more abrasive, we would shred our teeth and kind of grind them down. And it would make each tooth smaller, and it would make our mouths, when the teeth are smaller and there's gaps, actually our teeth kind of shift forward, and it would create more room for the wisdom tooth to actually grow all the way in place. But nowadays, because the food is more fine, I find that most people don't have enough room for the wisdom teeth to grow in place. And therefore, most people are recommended to have their wisdom teeth extracted.
And when should they do that? When should they, when does the observation, when do they grow anyway, and when does the observation for it start? Obviously, a person who goes regularly to a dentist really won't have to worry too much about it because the dentist will catch it, right?
That's right. We catch it early on with x-rays. We can see some wisdom teeth are kind of growing in sideways right from the beginning. And those, there's no way for the teeth that are growing in sideways to come out, actually. So we recommend those to be removed, usually around 17, 18 years old. Now, for the teeth that are growing in straight, we just let them grow in, and we'll see if there's enough room for it. If there's not enough room for it, then we recommend that they be extracted as well.
Mm-hmm. So what's all this hula hoop about? Everybody fearing a wisdom tooth extraction more than a root canal. Is that still true? Was that in the old days when surgery equipment wasn't so advanced? What's the deal there?
Yeah, I think wisdom tooth extraction, the fear of that comes from, really impacted wisdom teeth that are maybe growing in sideways or just very difficult to remove, and once they're removed, they're causing a lot of discomfort and pain to a few patients. And those kind of horrific stories kind of spread around, and therefore it makes everybody thinks wisdom teeth extractions are real terrible. But in reality, only a small percentage of wisdom teeth extractions actually cause a great deal of pain.
And that great deal of pain, is it real pain, or is it just the person needs to take more medicine for a longer time to, overcome that pain, or is it real pain which is unavoidable? You're putting the guy under, right? While you what?
No, definitely it's manageable pain. We always prescribe pain medication, and you know, on average, I would say patients take pain medication for a week or two, and then
I see. Okay.
you know they're back to normal.
Got it. And during that time, he's a little, maybe, it depends on how heavy it is. He might not want to drive and stuff like that. Be a little more careful there. And rather than that, he'll be fine.
That's right. That's right.
Well, all right. Thank you very much.
Thank you.